The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with another issue of The Genuine Article. And today I'm with Dr. David San, a pediatric cardiologist and a well-known authority in congenital heart disease. And we're discussing the recently released ACC AHA guidelines on patients with adult congenital heart disease, a very important topic, a very special group of patients. David, in recognition of the special nature of patients with adult congenital heart disease, not only of their special problems, but the fact that they're not nearly as commonly seen by cardiologists as acquired heart disease, there's a strong recommendation in the guidelines for centers of excellence to take care of those patients. What would a center of excellence consist of?
Well, it would require that there's adult cardiology input to deal with the issues of the aging of the heart. It requires somebody that really understands the natural history and treatment of congenital heart disease. It requires people that know how to do the imaging for congenital heart disease. It requires specialized people who know how to do interventional procedures, both catheter-based and surgical. And then there's a strong need to involve obstetricians, people who care for pregnant women with congenital heart disease, and a need for strong socio-psychological support services for these people.
And I think you probably agree that this is really very important to have such centers for these adults with congenital heart disease.
Yep. We need probably one in every state. We don't have that. We also need to deal with certain credentialing issues in terms of what kind of training would be required, both in terms of internal medicine cardiology and congenital heart disease knowledge. These patients have usually been taken care of by pediatric cardiologists, but if they end up in an adult hospital or an adult intensive care unit, it's not the pediatric cardiologist who's going to be taking care of them.
You know, there is a problem. I agree with you 100% that we're moving toward a specialty in adult congenital heart disease the same way we have them in interventional cardiology or electrophysiology. But the problem is there just aren't enough of those patients generally to keep a specialist busy full time, so that typically our specialists in adult congenital heart disease also do a lot of general cardiology.
Well, in some of the larger places, UCLA, Toronto, the Mayo Clinic, Philadelphia, there are at least 2 full-time people doing adult congenital heart disease. They may do 20% of other kinds of cardiology, but most of their time is spent taking care of these patients.
There's a couple of general points that I noticed in these guidelines. The first dealt with the fact that in many, many cases, the recommendations were based on a level of evidence of C, which means that the evidence supporting these recommendations was a bit soft. Why is that?
Well, it points out a need for research to really look at the outcomes in this population, to look at the various kinds of surgery that have been done. It really points out a need for ongoing understanding and documentation of these patients. And there are a lot of them that really have not been identified. They've been out of the cardiology care circuit for most of their lives.
Well, it certainly contrasts with acquired heart disease, where we often have multi-center trials and lots of data. And I think your point is well taken that clearly there's a need for more research and more hard evidence in regard to these patients with adult congenital heart disease. When we do a second show on this topic, David, I suggest what we talk about are some specific issues such as pregnancy. But for the Genuine Article, I'm Tony DeMaria.
Have a question or comment about a CVN story? Send us an email at cvnfeedback@acc.org.